Cholesterol. It's a word we hear all the time, isn't it? In the doctor's office, reading health articles, even walking down the grocery aisle.
Absolutely, it's everywhere.
But actually, understanding what it is, what your numbers mean, how you manage it, that can feel really complicated, like trying to untangle a messy knot.
It really can.
So today, we're going to try and cut through that. We're taking a deep dive into, well, a whole stack of sources on cholesterol, hyperlipidemia, and all the different medications out there.
Yeah, the goal here is to give you a clear path.
Our mission is really just to provide a clear, concise overview, make it make sense.
Exactly. Think of this deep dive as a shortcut to getting properly informed. We're not just throwing definitions at you.
Yeah.
We want to get to the why it matters, why your numbers are important, and how these treatments actually work, so you can have better conversations with your doctor too.
Okay, let's jump right in then. When we say cholesterol, what exactly is it?
Right. So the sources describe it as this waxy, kind of fat-like substance, and it's in every single cell in your body.
Every cell. Wow, so it's not automatically bad then?
Not at all. It's actually essential. Your body needs it to make hormones, vitamin D, substances for digestion, really important stuff.
But here's the catch, right? The sources make a big point of this.
Yes, your liver. It makes all the cholesterol your body actually needs, naturally.
Okay, so the cholesterol we get from food like meat, dairy, fried foods, that's extra.
That's the key word. It's extra. And that extra is where the trouble starts.
How so?
Well, too much of this cholesterol floating around in your blood can team up with other things and form plaque.
Plaque? Like on your teeth?
Sort of. But this is inside your arteries. It sticks to the artery walls.
Okay.
The whole process is called atherosclerosis.
Okay.
Think of it like rust building up slowly inside a pipe. You don't see it happening.
Silent but dangerous.
Exactly. Over time, this buildup narrows the arteries, sometimes blocks them completely.
And what happens then?
Well, the consequences are serious. It can lead to coronary artery disease that's blocked blood flow to the heart.
Right.
Or peripheral artery disease, which affects blood flow in your legs and arms. Or carotid artery disease, blocking blood flow to the brain.
Brain, heart, limbs. Basically, critical pathways.
Critical. And because it's often silent, you might not feel anything until there's significant damage, like a heart attack or a stroke.
Which is why getting checked is so important, even if you feel fine.
Precisely. Regular checks are key.
Okay, so that brings us to another point the sources really hit home.
Yeah.
Not all cholesterol is the same, is it? There are different kinds floating around.
That's right. Let's use that highway analogy again. Imagine your bloodstream is a busy road system.
Okay.
First, you've got LDL, low-density lipoprotein. That's the one most people know as the bad cholesterol.
Why bad?
Because it's the main source of that plaque buildup we talked about. It's like a big truck breaking down and blocking a lane on the highway.
Gotcha. Creates traffic jams in your arteries.
Exactly. And high LDL significantly raises your risk for heart attack, stroke, PAD.
Okay, so that's the bad guy. What else is on this highway?
Then there's HDL, high-density lipoprotein. This is the good cholesterol.
Good. How so?
Well, having enough HDL actually helps protect you. It acts like the tow truck on our highway.
Oh, okay.
It grabs that bad LDL cholesterol out of the arteries and carries it back to the liver.
To get rid of it.
Yep, the liver processes it and removes it from the body. So HDL cleans up the mess.
Nice. We want more tow trucks then.
Definitely. And finally, there are triglycerides. These are the most common type of fat in your body. Think of them as stored energy from the food you eat.
Is that bad too?
High levels can be, yeah.
Yeah.
Especially if your LDL is also high or your HDL is low. High triglycerides contribute to that plaque buildup as well.
So another risk factor.
Right. And our sources also mention VLDL, very low-density lipoprotein. Another bad type that mostly carries triglycerides around. Is all part of the picture.
Okay, LDL bad, HDL good, triglycerides. Also potentially bad if high. So how do you find out your levels of these?
It starts with a simple blood test, usually called a lipid panel or lipid profile.
The one where you often have to fast beforehand?
That's the one. Usually about 12 hours, yeah. They measure the levels in milligrams per deciliter of blood MGDL.
Okay, so you get the results back. What numbers are we actually looking for? What's considered good?
Right, let's break down the targets. For total cholesterol, ideally you want it to be less than 200 milli-GDL.
Under 200.
Yep. If it's 200 to 239, that's borderline high, and 240 or more is considered high.
Okay, and the LDL, the bad one?
For LDL, the main target is less than 100 milli-GDL for most people.
Under 100.
Now, if you're already at high risk for heart disease or you have it, your doctor might want it even lower, maybe less than 70 milli-GDL.
More aggressive target for high-risk folks. Makes sense.
Exactly. Borderline high LDL is 130 to 159. High is 160 to 189. And anything 190 or above is very high.
Wow. Okay. What about the good stuff, the HDL?
For HDL, higher is definitely better. You want that number up. Ideally, 60 milli-GDL or higher gives the best protection.
60 or more.
Generally, for men, they like to see at least 40. For women, at least 50. But yeah, 60 plus is optimal.
And triglycerides.
For triglycerides, the goal is less than 150 milli-GDL. If it's over 200, that's generally considered high.
Under 150 for triglycerides. Okay. Lots of numbers there.
It is. But your doctor helps you focus on your specific goals.
Which raises a really practical question. How often should people actually get these checks done?
Good question. It really varies. Depends on your age, your family history, other risk factors you might have.
So it's not one size fits all.
Not at all. Generally, kids get checked between 9 and 11, then maybe every 5 years. For adults, well, changes as you age. Younger men, maybe every 5 years. Middle-aged men, maybe every 1-2 years. Older men, annually.
And women?
Similar pattern, but the age brackets might shift slightly. Maybe every 5 years when younger, then more frequently, like every 1-2 years as you approach and go past menopause, not annually.
But the key is,
if you have risk factors, family history, diabetes, high blood pressure, smoking your mother's, your doctor will likely want checks much more often. It's personalized.
Right. Always talk to your doctor. Okay, so let's say you've had the checks and your numbers. Well, they're not where they should be. What's step one?
Step one, universally emphasized in all our sources, is lifestyle changes. This is always the foundation.
What kind of changes are we talking about?
We're talking actionable things. Eating heart-healthy foods, that means cutting back on saturated and trans fats. You know, the stuff in fatty meats, whole-fat dairy, fried foods.
More fruits, veggies, whole grains.
Exactly. Plus, regular exercise. Hugely important. Quitting smoking is massive. Limiting alcohol. Managing stress, getting enough sleep, maintaining a healthy weight.
It's the whole package, really.
It really is. These aren't just suggestions. They're powerful interventions.
And this is a big bet that sources point out. Sometimes lifestyle changes alone aren't enough, right?
That's a critical point. It's fascinating, actually. For many people, even with their best efforts, lifestyle changes just don't bring the numbers down sufficiently.
And high cholesterol or hyperlipidemia, it's really common, isn't it?
Incredibly common. The stats are pretty staggering. Sources mention 93 million American adults over 20 have high total cholesterol. And in the UK, it's something like 66% of adults.
Wow. So it's not about personal failure if lifestyle isn't enough.
Not at all. It's a widespread health issue. Genetics play a role, other factors. So if your numbers stay high despite lifestyle changes, that's when medication often becomes a really necessary and effective partner.
And that decision is made with your doctor.
Always. It's a discussion. Looking at your individual risk, your specific cholesterol goals, and it's important to understand managing high cholesterol is usually a long-term thing. Ongoing management.
Okay, so let's get into the medications. This is where things get really interesting and maybe a bit confusing for people. Let's unpack the different types.
All right. Let's start with the most common group, often the first choice, statins.
Statins? Heard of those. How do they work?
They're pretty clever. They work mainly in your liver. They block a specific enzyme, the HMG-CoA reductase, which is essential for your liver to make cholesterol.
So they slow down the cholesterol factor.
Exactly. Less cholesterol gets produced. Plus, this action also makes your liver put out more receptors on its surface that grab LDL cholesterol from your blood. So it clears more LDL out of circulation too.
Double action then. Lower production, higher removal.
You got it. And their main benefit is being really effective at lowering that bad LDL. But there's more. Yeah. Sources highlight these extra benefits. Statins can improve the health of your blood vessel lining, reduce inflammation, help prevent blood clots, and even stabilize existing plaques, making them less likely to rupture.
So they do more than just lower numbers. They actually protect the cardiovascular system.
That's a key part of why they're so widely used. Now, side effects. What should people know?
Right, the downsides.
Common ones can be things like constipation, nausea, headaches, maybe some muscle soreness. Less common, but possible, are liver enzyme changes, sometimes a small increase in blood sugar, and rarely some reversible memory issues.
Muscle soreness is one people hear about a lot.
It is, and sometimes people just don't tolerate statins well. That's statin intolerance. Also, be aware, certain statins don't mix well with grapefruit, and limiting alcohol is a good idea to protect your liver.
So what does this all mean for you, the listener? If you start a statin and get muscle pain,
tell your doctor right away. It needs to be checked out. While the really severe muscle breakdown, rhabdomyolysis, is incredibly rare, like 1 in 100,000 treatment years.
Very rare.
Very rare. But the risk is a tiny bit higher if you take statins with certain other drugs like fibrates or niacin, or if you have kidney problems, thyroid issues, or alcoholism.
Good to know. And who shouldn't take statins?
Definitely not for people with active liver disease or if you're pregnant or breastfeeding.
Okay, so statins are the workhorse. What if they aren't enough or someone can't take them?
Great question. We have other options now. PCSK9 inhibitors are a newer class.
How do they work?
They're antibodies that target a protein on liver cells called PCSK9. By blocking this protein, they help the liver pull more LDL cholesterol out of the blood.
So another way to boost LDL removal.
Exactly. These are often used for people at very high risk who haven't hit their goals with statins or sometimes added to statins. They're given as injections maybe every few weeks.
Injections, any side effects?
Can include muscle or back pain, some swelling where you get the shot, maybe flu-like symptoms. The big thing here often is cost. They can be quite expensive and usually need insurance approval.
Okay, what's next?
Fibric acid derivatives, or fibrates. Their main job is lowering triglycerides.
Ah, focused on triglycerides.
Primarily, yes. They can also give a little boost to the good HDL and slightly lower LDL production. They're often used for what's called mixed hyperlipidemia, when both cholesterol and triglycerides are high.
Or for specific groups.
Right, like patients with low HDL and high risk of atherosclerosis, maybe someone with type 2 diabetes. Side effects can be GI issues, constipation, diarrhea, bloating, sometimes muscle pain. And they're not for people with severe kidney or liver disease. They can also interact with blood thinners.
Okay. Fibrates for triglycerides. What else is in the toolkit?
Bile acid sequestrants, sometimes called resins. These work differently right in your intestine.
Not in the bloodstream.
Correct. They bind to bile acids in your gut. Bile is made from cholesterol, remember?
Right.
By binding to bile, they prevent it from being reabsorbed. So your liver has to pull more cholesterol from your blood to make new bile, lowering your blood cholesterol levels that way.
Clever. Indirect approach.
It is. They mainly lower LDL, might give a small HDL boost. Side effects are mostly gut-related: constipation, gas, nausea.
Any tips for taking them?
Yes. If it's a powder, mix it well with liquid, and timing is key.
Yeah.
Take other meds either 1 hour before or 4 hours after the sequestrant so it doesn't block their absorption.
Good practical advice. Any other considerations?
They can interfere with absorbing fat-soluble vitamins A, D, E, K. And interestingly, they might sometimes increase triglycerides.
Everything on?
Next up, selective cholesterol absorption inhibitors. The main one here is ezetimibe.
What does that one do?
Its name kind of says it all. It selectively blocks the absorption of cholesterol from food in your intestine.
So it stops it from getting into your system in the first place?
Pretty much. It lowers LDL, might help a bit with triglycerides and HDL. It's often used with a statin for a stronger effect.
Side effect.
Generally mild. Maybe some diarrhea, fatigue, joint pain.
Okay. What about niacin? I think I've heard of that.
Nicotinic acid, or niacin, yes. It's actually B vitamin.
B-vitamin.
Yep. In prescription doses, it works broadly to limit the liver's production of blood fats. So it lowers LDL and triglycerides, and it can be quite good at raising HDL.
Raises the good stuff. What's the catch? People talk about flushing, right?
That's the main side effect, yeah. A warm, red feeling, usually on the face and upper body. Taking it with meals, or sometimes taking aspirin beforehand, can help reduce that.
Other side effects?
Can include itching, headache, upset stomach, and it might increase blood sugar. So caution there. Not usually for people with gout or severe liver disease.
And you mentioned prescription doses.
Very important point. You can buy niacin supplements over the counter, but they're not regulated the same way. The dose might be inconsistent, side effects can be serious. You really need medical guidance if you're considering high-dose niacin.
Don't self-treat with OTC niacin for cholesterol. Got it.
How about fish oil?
Omega-3 fatty acids esters, often called fish oils. In large prescription doses, we're talking 2 to 4 grams. They're specifically used to lower very high triglycerides.
Again, targeting triglycerides.
Primarily. They work by decreasing triglyceride secretion from the liver and helping clear them from the blood.
Side effects: fishy burps.
That's a common one. Belching, fishy taste, sometimes a rash. More importantly, large doses can slow blood clotting. So potential bleeding risk.
Yes. You need to discuss it with your provider, especially if you're on other blood thinners. It could increase bleeding risk, including a rare type of stroke, also potential issues with blood sugar control in diabetics, and allergic reactions if you have fish or shellfish allergies.
So definitely requires a doctor's oversight.
Absolutely, not just popping supplements.
Okay, one more class you mentioned. Newer one.
Right, adenosine triphosphate citrate lyase inhibitors, or ACL inhibitors. Bempedoic acid is the example.
That's a mouthful.
It is.
Yeah.
But the mechanism is key. It also works in the liver, slowing cholesterol production, but via a different pathway than statins.
So an alternative route to the same goal.
Kind of. It's usually used with statins, and there are specific dose limits if combined with certain statins like simvastatin or pravastatin.
Side effects for this one.
Can include things like upper respiratory infections, stomach or back pain, muscle pain, possibly increased uric acid, or even tendon injury.
Wow. Okay. That's quite an arsenal of medications.
It really is. Lots of different ways to tackle the problem.
So understanding these is great, but how do you actually manage being on one of these medications day to day? What are the practical tips?
Yeah, this is crucial. First, really follow your provider's instructions to the letter. Ask questions if you're unsure about anything.
Don't just nod along.
Exactly. And take the full dose. Don't try to cut pills to save money. If cost is a barrier, talk to your doctor or pharmacist about assistance programs. There are options.
Good point. Consistency is key too.
Absolutely. Refill prescriptions on time. Set up a routine, take it the same time each day. Makes it harder to forget.
What about travel?
Always take extra doses with you, plus copies of your prescriptions, just in case.
And this seems really important. Talking to your doctor about everything else you take.
Critical. Always tell your provider about any other medications. OTC stuff, herbals, supplements. Interactions can be serious. They can make your cholesterol meds less effective or increase side effects.
And tell other doctors too, like before surgery.
Yes. Inform all your healthcare providers, including dentists, especially before any procedure needing anesthesia. They need the full picture.
That brings up the natural alternatives question again. People often ask about those.
It's a common question. Red yeast rice, for instance. It actually contains a substance chemically similar to statins.
Really?
Yeah. So it can lower cholesterol, but because it's a supplement, the dose and purity aren't guaranteed like a prescription. It might be something to discuss with your doctor. Needs careful monitoring if used.
What about plant stanols?
Those work by blocking cholesterol absorption in the gut. You find them in some fortified margarines and supplements. They can help a bit.
But the big caveat?
The big caveat is natural does not equal safe. Supplements aren't regulated like drugs. They can have side effects. They can interact dangerously with your prescriptions. You absolutely have to discuss any supplement with your provider before you start taking it.
Don't replace your prescribed meds with supplements without talking to your doctor. Okay, so looking at the big picture here. High cholesterol sounds serious, maybe lifelong. Is the outlook positive?
If we connect all this, yes, high cholesterol is serious, and usually it is a long-term condition requiring management. But the key takeaway is that it's highly manageable.
Manageable how?
Through that combination we've discussed. Sticking with healthy lifestyle habits consistently, taking your medication as prescribed if you need it, and having regular checkups and conversations with your healthcare provider.
And doing all that really lowers the risk.
Significantly. It drastically reduces your risk of those major problems like heart attack and stroke. You really can take control.
So what does this all mean for you, listening right now?
It means you're not powerless against high cholesterol. You have information, you have options.
It means being proactive, right?
Yeah,
understanding your own numbers, knowing what treatments are out there, and working closely with your doctor.
Exactly. It's about engagement, charting your best course forward together.
Well, we've covered a lot today. We've really tried to unpack cholesterol, understanding the good, the bad, the numbers.
Emphasize that crucial role of lifestyle.
And then we dove deep into all those different medications, how they work, what they do, each one unique, but all aimed at protecting your heart.
It's a complex topic, but hopefully we've made it a bit clearer.
Definitely. And as we wrap up, here's something to think about, maybe discuss with your doctor next time.
The final thought.
Yeah. How might understanding the specific way your cholesterol medication works, the mechanism we talked about, actually empower you?
How could knowing the how change the conversation?
Exactly. How could it help you have a more informed, more personalized discussion about the absolute best long-term strategy for your cardiovascular health? Something to chew on?